Food can look, smell, and taste perfectly normal, but still contain millions of bacteria. These microbes cause food poisoning. Half of all food poisoning cases start in the kitchen at home, not in restaurants. That's why I will tell you most common scenarios and causes of food poisoning and how to treat them. The most common cause of food poisoning is a virus. It accounts around 60% of food poisoning cases. When you eat even slightly contaminated food within 12 hours, it can cause watery diarrhea and sudden vomiting in children, nausea, abdominal cramps, low-grade fever, and headache and body ache sometimes is possible also. Viral food poisoning is very common on cruise ships and holiday resorts. This is the classical norovirus outbreaks. In schools, daycare centers, and kindergartens, it is usually rotavirus infection. The source of viral infections is often salads, sandwiches, and desserts contaminated by sick food handler. Sometimes it comes with contaminated ice and water. Symptoms usually resolve within 1 day, sometimes up to 3 days. Treatment in this case is oral rehydration solutions. If you want to make it at home, 1 liter of water, 6 teaspoons of sugar and 0.5 teaspoon of salt, mix and drink in small frequent sips. From medications, ondansetron oral tablets can be used. It blocks serotonin receptors and stops vomiting. Useful in severe vomiting cases. Intravenous fluids are needed if there is severe dehydration. Antidiarrheal drugs like loperamide is not used in children. In adults, they can be used in severe diarrhea cases, but only if there is no fever and no bloody stools. The second most common cause of food poisoning is bacterial infection. Bacteria can produce toxins in food. Even within 1 hour of eating, symptoms may appear due to these toxins. But if symptoms occur after 6 hours, it means that bacteria invade and multiply in the gut. Such bacteria are Salmonella, Shigella, coli, and Campylobacter. Symptoms are diarrhea, watery and sometimes bloody, abdominal pain and cramps, fever and chills, nausea, and sometimes vomiting. It looks like viral infection, but fever is more common, and bloody stool and mucoid stool is strongly suggests bacterial infection. Sometimes food poisoning causes death from sepsis, kidney failure, or dehydration. Severe abdominal cramps are typical, especially with Shigella and Campylobacter. For treatment, antibiotics are usually avoided in mild cases. They are used only in severe or prolonged infection or high-risk patients. The most common causes of bacterial food poisoning are undercooked poultry and eggs, usually with Salmonella, unpasteurized milk, usually with Campylobacter or Escherichia coli, rice dishes left overnight, usually Bacillus cereus, mayonnaise, cream cakes, deli foods handled improperly, usually with Staphylococcus aureus toxin, and improperly canned foods causes botulism and botulinum toxin intoxication. It's rare but very deadly. Diagnosis is usually made by symptoms, but sometimes stool culture is required for confirmation. For Salmonella, Shigella, Campylobacter, and Escherichia coli. Bacterial infection can last from 3 days to 7 days. Recovery is usually complete, but some species like Escherichia coli 0157 and Campylobacter can cause long-term serious complications. Treatment is rehydration, its mainstay, oral rehydration solutions or intravenous fluids if severe. Antibiotics only in specific cases like dysentery with bloody stool and fever, or in immunocompromised patients such as very young or old. Common choices among antibiotics are ciprofloxacin and azithromycin. But be careful, in E. coli, 0157, antibiotics can worsen condition and can cause hemolytic uremic syndrome. It's a huge problem. It can cause kidney failure. Ondansetron can be used in severe vomiting cases, and oral rehydration solutions is most effective. It prevents 90% of dehydration complications. Probiotics can be effective, like Saccharomyces boulardii and Lactobacillus. It shortens illness time around 1 day. Ginger and peppermint tea can be used. It's beneficial for nausea and for symptom relief. Rice water or plain rice can have binding effect and reduce stool frequency around 25%. And bread diet, banana, rice, applesauce, and toast are common foods which supports diarrhea. Activated charcoal can be effective, especially if taken early for toxins. Activated charcoal can reduce toxin absorption if taken early. And third most common cause of food poisoning is parasitic infection. It is rare but more common in developing countries and among travelers. Such parasites are Giardia lamblia, Enteroamoeba histolytica, and Cryptosporidium. The incubation period here is much longer, sometimes weeks, not hours. It causes long-lasting diarrhea, often fatty, foul-smelling, and mucus-filled stool. It's not usually self-limited and requires antiparasitic treatment. Symptoms are chronic watery diarrhea. It can last more than 2 weeks. Abdominal cramps, bloating, and excessive gas, nausea, usually no fever, weight loss, or mucus in stool, fatty, greasy stool, steatorrhea, especially with Giardia. Prolonged diarrhea strongly suggests parasitic infection. For diagnosis, stool should be examined with antigen or PCR testing. For treatment, metronidazole is effective in Giardia case. Hydration is still very important. Garlic may have some benefit in some parasitic infections, and certain probiotics. Low-fat, lactose-free diet is recommended. And the fourth most common cause of food poisoning is toxins and chemical poisoning. It's rare but most dangerous. Sources are wild mushrooms, reef fish, pesticides, shellfish, heavy metals, and botulinum toxin. In this case, onset is very fast, from minutes to hours. Usually no fever. Neurological signs can appear like tingling, dizziness, and paralysis. Botulism causes descending paralysis plus blurred vision and not diarrhea. Mushrooms causes vomiting and sometimes liver failure. Fish toxins cause flushing, tingling, hot and cold reversal. Cold feels burning. This is classical sign. In this case, you should avoid alcohol, nuts, caffeine, and fish for weeks. Most common causes of toxin poisoning are improperly canned vegetables and or fish, cause botulism, wild mushrooms ingestion, amanita poisoning, reef fish like barracuda and grouper can cause Shigella toxin, spoiled tuna or mackerel, they can cause scombroid histamine poisoning, and pesticide contaminating food, organophosphate toxicity. Treatment at this case, in case of botulism, is antitoxin and ICU care. In case of mushroom poisoning, activated charcoal and acetylcysteine, liver transplant in severe cases. Scombroid poisoning, treatment is antihistamines, and Shigella poisoning, supportive care, and mannitol intravenously in severe neurological cases usually is enough.